Welcome all. I'm Dr. Naresh Babu, an occupational therapist. Today we are going to see about oncological rehabilitation. The cancer is being grown and many know about this. Cancer is a part where extra growth happens in any parts of the body. The role of occupational therapy in oncology is to facilitate individual clients to maximize their physical functional performance in physiological and psychological in well-being in everyday task life regardless of their life expectancy. Mainly the maximizing this physical functional performance is through management of ADL activities which are limited in cancer rehabilitation through the treatments like chemotherapy or surgery, or they have a radiational therapy which limits their functions in everyday tasks by limiting the range of motion, mobility and endurance, and also the coordination in doing the everyday task activities, which can be modified by providing an ADL strategies towards to the individual clients and also to the caregivers. ADL means activities of daily living, which includes all self-care activities like bathing, dressing, grooming, and toileting and transferring skills. Mainly these functional performance are limited for this cancer clients who had gone for surgery, treatment like chemotherapy or radiational therapy, which there limits the range of motion, mobility, and endurance and coordination while doing these activities. As an occupational therapist, we try to provide and management through lymphedema management, sleep management, and other compensatory strategies to do well in their home. Even the caregiver burden can be reduced by providing the strategies given to them as an assistive technologies being modified in their home for carrying their goals and achieving their maximal potential. Lymphedema, it is a swelling occurs due to the treatment occurs for the cancer clients. Like in oncological rehabilitation, mainly the laser treatment or the radiation treatment makes the lymph nodes exaggerated and provides lymphedema or the edematous. It's otherwise called swelling, occurs in any parts of the joints and also in the generalized body, which can be reduced by providing a resting position, pneumotopic exercises, which can reduce this swelling in parts of the body where the limiting range of motion can be occurred, and we can able to make them to do the everyday activities in maximum potential. Pneumotopic treatment or the air-filled therapy is to reduce edematous at the generalized body like a compression therapy or a decompression therapy to reduce edema, which as an occupational therapist we used to follow a term called retrograde massage techniques. So this can be engaged with that pneumatic treatment technique. Mainly the cancer clients have a sleep problems or sleep engaging problems. This can be reduced by providing a cognitive strategies like energy conservation and relaxation or stress relieving techniques to maintain their sleep hygiene and sleep wake cycle. So this will engage them to do their cognitive and physical activities in meaningful way for gaining their life with an fun-filled work style. To reduce the caregiver burden, we provide the home modification techniques to carry them with good care and support and assistance, and always they have a feel that endurance being carried throughout their life. Most of the cancer clients will be available at the hospice care or a palliative care rehabilitation setups, and many rehabilitation centers can able to provide this palliative care techniques where their life expectancy will be limited, but they can able to do their everyday activities by occupational therapy strategies. Thank you very much for listening to occupational therapy in oncological rehabilitation. Thank you.